Let's talk a little bit about NBA just because I've gotten a lot of questions about a couple players, and honestly, the NBA has a ton of star players that are injured somehow. So we have Chet Holmgren, who had an iliac wing fracture, and there hasn't been an incidence of that happening in an NBA player in history. So it is quite a random injury. It's basically a high impact force to the top of that ilium bone, and you can see there typically it's a non-displaced fracture, and it sounds like from all signs and news that this is a non-displaced one type fracture as opposed to a comminuted where it's broken into multiple pieces. So when it's broken into multiple pieces, then we talk about surgery, but with a non-displaced fracture, it's about a 6 to 8 week recovery. We've heard word that Chet Holmgren will be back this season, so that's further evidence that this is a non-displaced simple fracture of that ilium. And I would say that he would probably require a bit of a ramp up period. So I would say close to that 9 to 10 week would be a reasonable return expectation for Chet. Shouldn't be any kind of significant performance limitations and should be back up to par. Going on with kind of crazy injuries, Morant had a hip subluxation. So what that means is that femur bone right over there that's nestled in the hip joint, it partially shifts out of that socket, but it doesn't completely dislocate and then it pops right back into place. The problem with that is that there's something called the labrum, which surrounds the edges of that femur and helps stabilize it. In about 50 to 80% of cases, that labrum is torn, but you would also associate these pelvic muscles here with a strain. They said Morant has a couple of strains as well. You would think this would hold him out for a significant period of time, and you would think that not a lot of players have this injury, but honestly, this has happened quite a bit to DeMarcus Cousins, Rudy Gobert, Jahlil Okafor, and Jokic. And the thing about it is that they really only miss a couple of weeks. So it's about a 2 to 3 week absence typically. And actually, Jokic in 2020, he played through the injury, which was kind of crazy. So I'm pretty surprised about this, but there is a good chance that the labrum has some sort of minor tear in it. It's not something that needs to be addressed urgently, so we'll likely see Morant out for, I would say, about 3 to 4 weeks, and then he should be able to return. But we have to keep a close eye on his pain aggravation. If it's really starting to bother him, then there is a chance that they could proceed with a possible labral repair or labral surgery. But based on analytics, it doesn't seem like that would be the case. Let's talk hamstring injuries. We've talked about before about how that right hamstring is the most commonly injured one. That's the bicep femoris. It's got a dual innervation, which makes it more susceptible to injury. And we've also talked before about how hamstring injuries are about a 3 to 4 week recovery in the NFL. That's about the same in the NBA, and that's what I expect for a little bit longer recovery for Zion Williamson, because it sounds like he has a more moderate high grade one, maybe a low grade 2 hamstring. Grade 1 is just significant inflammation, and grade 2 is actually a discrete tear in the hamstring. So Kevin Durant has a calf strain, and we've heard that before. It actually happened the same season that he suffered his Achilles injury, and people attributed the calf strain to contributing to the Achilles rupture. There's not a lot of evidence that shows that an acute calf strain with no signs of tendinosis in the calf or any kind of degeneration in the Achilles tendon has increased the risk, but it is something that people worry about now just because of causality. The good thing is that the calf strain is in the opposite ankle of the previous tendon rupture for Kevin Durant. So as long as it is just a calf strain, we have a shorter timeline for return. It's about a 2 to 4 week absence. And I would actually lean to it being closer to that 2 week time just based on recent calf strains and their recovery as well. They talked about Lonzo Ball having a wrist sprain that if he played through it at the time could have necessitated the need for surgery, but he is expected to play this upcoming week, so that makes me think that he's suffering as well from a distal radial ulnar junction sprain and not a scapholunate ligament injury, which would be something that would be a multi-week absence, couple month absence, and they wouldn't really return him back this quickly because there is a significant degree of instability that's associated with and high risk of worsening the injury. We talk about the distal radial ulnar junction. You see the radius here, you see the ulna here. There is this fibrocartilage disc up there, and there is the ligament that connects these two bones, and then there's the ligaments that connect the two long bones to the small carpal bone that lunate up there. When that's inflamed, that can cause a significant amount of pain, and if it does significantly worsen, then that can require surgery, but in grade 1 sprains, it is okay to technically play through it. Like I said before, Lonzo Ball has said that he's going to be playing in this upcoming week's tournament, so I think that this is the most likely wrist sprain that we would be dealing with that is both something that you can return quickly from, but also something that you're at risk for having surgery if you play through too severe of an injury. And that's the NBA breakdown. Let me know what you guys think.